Solutions for perimenopause. No more guessing, no more confusion, no more nonsense. Here's the real information. I help women with perimenopause every day. I help women in my clinic every day. I'm Krista. I have more than 20 years of experience with women's health and perimenopause, and I'm perimenopausal too. Perimenopause is not about hormone deficiency. In the early part, it is about hormone volatility and instability. As you get closer to menopause, and when you are menopausal, then it is about deficiency, not having what you need. In the beginning, your ovaries start to just malfunction. Your brain and your ovaries are not communicating correctly. So it may lead to brain fog, anxiety, poor sleep, irregular cycles, mood swings, or night sweats, or even hot flashes, but usually not those drastic symptoms yet. In the beginning, your periods are pretty regular for the most part. You just have days where you feel off. So your overall hormone pattern is still normal. You're still having the nice ebbs and flows of the cycle. And then you start to have like little changes within the ebbs and flows. And as those drop, that's when you have the symptoms. So in order to stabilize your hormones, most often, if you're still having monthly cycles, you just need a little support, which we utilize low-dose birth control. Hear me out. So low-dose birth control helps to prop up your foundation and prevent you from dropping too far down. It gives you the same dose every day, which makes you feel more stable. Low-dose birth control helps to smooth out those highs and lows. It's best for women who are still cycling. Maybe you're having some irregular cycles, but you're still mostly having more than 6 cycles a year. You need birth control. That's a big one. If you still need birth control, then obviously we need to have a high enough dose to prevent pregnancy. Once you've transitioned over to you're not having very many cycles, you're only having less than 6, let's say 3, 4 a year, and you don't need birth control. Let's say your husband or your partner had a vasectomy, or you've had your tubes removed. You don't need birth control anymore, or you have an IUD, right? So if you're still having a few cycles, but not very many, and you're mostly transitioned to the other side or closer to menopause, then we would switch over to what we call hormone replacement therapy. And this is a more of a long-term treatment option. The low-dose birth control is meant to be like a bridge to cover the gap when you're sort of in no man's land. I call it the Wild West because that's what it feels like. Once you're further into it and you're closer to menopause and closer to stopping your cycles completely, then we switch you over to an estradiol patch and oral micronized progesterone. And here is that pill. So the patch goes on your skin. They come in weekly patches or twice weekly patches. I prefer the twice weekly patches. They stay on better. I feel like the weekly ones have a little bit of trouble with the adhesive sometimes. Estradiol patches replace your estrogen. That's exactly their role. They are bioidentical. Estradiol means bioidentical, whether it's a pill, a patch, a cream, a gel, a spray, a mist, whatever it is, they are all bioidentical. Our hormones are so much better than they used to be. So patches are great because they give you steady delivery. Patches also avoid the first pass metabolism of your liver. And so that is super helpful. It keeps our risk of blood clots very, very low, which is ideal. Estradiol helps with hot flashes. It helps with night sweats. It helps with irritability, helps brain fog, joint pain, and palpitations. Obviously, many, many more. All right, progesterone. So whereas estrogen really helps us with a lot of those symptoms I mentioned, progesterone is the most important. It's the most important because it helps protect our uterus from abnormal cells. You take it at night before bed. It will help you sleep and it will take away the 3 a.m. wake ups. If you have a uterus, you have to take progesterone. It helps to calm our nervous system, which is very important. Helps us sleep and reduces our anxiety and helps stabilize our mood. So, birth control stabilizes our hormones, and hormone replacement therapy replaces our hormones. There are fears around hormones. I know you've heard them. A lot of it is from data that was more than 2 decades ago. Some of the data was misinterpreted. A lot of the data was misinterpreted. We now have modern, safer hormones. We have modern dosing, which is better, and modern delivery of those hormones, which is also better. And we use a individualized care. So it all depends on where you're at on the timeline. They're both great. They are both valid. They are both utilized a lot in our job. So remember, I am not your nurse practitioner, but you can meet with your person, your provider, go over your risks and your contraindications and your best options. A lot of hormone fear comes from outdated information. It's important to talk to your healthcare provider. And it's important to get good education and good information and not feed into the fears. Education is the most important thing. It's about our quality of life. It's about our symptom management. It's about our sleep. It's about our mental health and our mental clarity. And it's about our emotional stability and our long-term bone and heart health. Those are the most important things. If you think you're perimenopausal, you probably are. If you're questioning your symptoms, then you most likely need treatment. You're not broken, and it doesn't have to be complicated. It doesn't have to be confusing, and it doesn't have to be expensive. So follow me here to get all of the clarity, the information, the real information without the gatekeeping, without the nonsense. Take care.